Hi, welcome to today's webinar. It's part of the KaiNexus Continuous Improvement webinar series. It's titled Beyond the Voice of the Customer, How Richer Customer Signals Can Improve Continuous Improvement. I'm Mark Graben, a senior advisor with KaiNexus. I'll be your host and moderator today, and I'm very excited that we're joined by two presenters. I'll introduce them more formally in a moment. They are Volker Probst and Annette Behrensmeyer. They are both managing partners with their firm, Resonance Growth Partners. At our presenters today, first off, Annette Behrensmeyer. Annette brings more than a decade of experience designing enterprise CX strategies, customer experience strategies, analytics frameworks, and feedback to action operating models across different businesses. A global CX leader and Forrester certified CX professional, she's unified customer-facing functions under shared goals, embedded customer insight into executive decision-making, and guided organizations through CX maturity transformations globally. Having worked both inside a leading CX platform provider and as a senior CX executive, she knows where traditional VOC approaches create value and where they quietly limit impact. And we're also joined by Volker Probst. Volker brings more than 25 years of experience turning customer insight into action at enterprise scale. As a former global CX and operational excellence executive, he has designed and led CX improvement systems that move organizations towards signal-based, behavior-driven experience improvement. His work has helped global organizations reduce friction across critical journeys and translate customer signals into operational change, delivering lasting gains in business impact, experience, and engagement. Creating a tailored experience system, he helps CX teams move from listening to customers to fixing what actually breaks the experience. Again, very excited that you're both here, Volker and Annette. I'll turn things over to you for the presentation. Thanks.
Fantastic. Thank you so much, Mark. And thanks, everybody, for having us. Like Mark said, we are at Resonance Growth Partners, and our focus is really on helping organizations connect three items: customer understanding, employee insight, and then business performance. And so over the years, we've noticed continuous improvement and customer experience teams are often trying to solve many of the same problems, and they're not always looking at the same signals. Today's session is not about teaching CX, though, so I can reassure you there. It's also not about introducing a new methodology at all. It's really about exploring how those customer signals can strengthen the improvement systems that many of you would already have in place. So you will see practical ways that customer understanding can help identify friction earlier, strengthen prioritization, and then improve outcomes for all, for the customers, for the employees, and the business. So let's start with a very simple idea. Every process problem is a customer problem in disguise. As CI professionals, you're already experts at finding ways, reducing variation, improving flow, solving operational problems. But customers experience those very same problems differently. As I mentioned, I'm actually in Germany right now. I don't know if anybody's dialing in from Germany or has maybe previously visited Germany and perhaps traveled by train. If that's the case, one example that probably resonates with you is the German railway system. Doesn't always have the best reputation, if I may put it that way. So imagine, and this is a real story, I'm traveling to a meeting and I need to make a connection. So there is an app, which is great, right? I check the railway app and I see that my first train is delayed. The app tells me you have plenty of time, and I decide I'm rather going to stay in that cozy cafe instead of rushing to the platform, right? Makes sense. However, the train arrives only a few minutes late instead of the much longer delay that was predicted in the app. And so by the time I actually realize what's happening, the connection train has left, is gone. Now, pause for a minute in the story and think from an operational perspective, right? From a dashboard perspective, this is just a data accuracy issue, right? Or schedule variance. But now I'm standing there, and from my perspective, what I'm feeling, what I'm experiencing is somewhat different. I'm standing on the platform. I'm wondering, how am I going to get where I need to go? I'm realizing I'm missing an important meeting, most likely. I have to figure out some kind of alternative route. And then, fun fact, in Germany, often there are different train operators. So my next train is operated by a different company, which means I cannot use the ticket that I already have. I actually have to now figure out a way to buy another ticket. So from my customer, in this case, perspective, what started as a small operational issue has now created uncertainty, frustration, effort, of course, and additional costs. So the operational issue and the customer issue are two sides of the same coin. They're experienced differently, but they are two sides of the same coin. And that really is why customer signals are so valuable. They help us understand not just where a process is breaking down, but how that breakdown is being experienced by the people we're ultimately trying to serve. So a delay becomes uncertainty. The handoff becomes frustration. A defect is a broken promise. And a complicated process is unnecessary effort on the customer side. And so one of the things that we've learned is many organizations are very good at solving visible operational problems. But the opportunity that we want to look at and discuss today is how customer signals can help us identify the problems we don't yet fully see and help us prioritize the ones that matter most. So it's not replacing VOC, voice of customer. It's to add another lens that helps us understand where friction already exists and where that improvement work can create the greatest value. So before we go a little bit deeper into those signals, let's just establish a common language around customer experience. And I promise we're not going to go into detail here. I'm sure you've heard this definition and maybe customer experience as a methodology or maybe as a team before. But just to make sure we use the same language. Forrester defines customer experience, as you can see here, how customers perceive their interactions with an organization, whether those interactions are effective, easy, and emotionally engaging. And there's 4 words that I want to just quickly point out. One is perceive, perception. The funny thing about perception is it doesn't matter if it's the truth. It really doesn't, unfortunately. And anybody on this call that's in any kind of relationship knows that perception is not about the truth, right? It's how the customers perceive their interactions. So it's entirely up to them. And then the other 3 are all starting with an E, and this is what Forrester calls the 3 E's, right? Effective. Did the customer accomplish what they needed to accomplish? Pretty simple. Easy. How much effort did it take? And emotionally engaging. How did the experience, that number of interactions, that single interaction, how did the experience make them feel? And we make a lot of decisions based on how we feel about an experience, if we think about it for a minute. So what's particularly relevant for you is that operational friction impacts all 3 of these 3 E's. A delay makes an experience less easy. A process failure makes it less effective. And poor communication can create frustration, I certainly felt that, anxiety, and loss of trust. Next time I book that train connection, will the same thing happen? So customers don't experience process variation or workflow inefficiencies, right? They experience confusion, effort, waiting, and uncertainty. So when you hear us speak about customer experience throughout this webinar, what we're really talking about is the customer's perspective on the operational system we all work within. And so that brings us to customer signals. So let's look at the full spectrum of customer signals. What you see on the left, you're very familiar with that. Most organizations collect customer feedback, right? I doubt there's any out there that don't do any of it, right? I mean, how would they stay with? But okay, I should never say never, right? So on the left-hand side, you are familiar with this. Surveys, interviews, focus groups. These are valuable. We're not saying they're not, right? They are valuable. They aren't going away. Even if survey response rates are dropping globally, they're still not going away. I see some comments, so maybe that means unfortunately for some of us, but they are here for good. But they are all examples of solicited feedback. And so that brings me back to the VOC, right? We ask customers what they think. It's the voice of the customer. So they have to do something to have their voice heard. They have to speak up. So if you're asked to speak up, if you have to do something to make your voice heard, what do you associate that with? Effort, right? There's effort immediately implied in that. So what's exciting really in today's time is the growing ability of everything that's going on the right-hand side of this slide. And that's the ability to learn from signals that customers generate naturally as they interact with our organizations. So take a quick look at this list. Repeat contacts, transfers between teams, escalations, frontline observations. So what's interesting is that many of these don't look like customer feedback at all if you first look at them. They look like operational data. And that's exactly why they're so powerful. Many organizations wait for complaints before recognizing friction. But by the time a customer complains, they've often already experienced not just one, but multiple process failures. A repeat contact is a signal, right? A transfer is a signal. An escalation is a signal. Frontline employees saying, I've heard this issue 3 times this week, is a signal without the customer saying anything in their own voice. These signals almost always come before the survey score even moves, before the complaints increase, before the customer leaves. So today, what we'd like you to encourage to do is think differently about them. They're not just operational metrics. They're customer signals hiding inside your operational systems. And when we start treating them that way, we can identify friction earlier and prioritize improvement work more effectively. So we will revisit this question later. Where do unsolicited customer signals hide in your organization? So already keep that in the back of your mind if you want an extra few minutes to think about. But these already exist in your organizations. They do. So how do we connect them to improvement systems in a way that drives action rather than simply generating more data? And that's exactly what Volker is going to walk us through.
Hey, thank you, Annette. I will start with a small story to highlight, typical CX voice of the customer approach and, CI voice of the customer approaches out there. This might not be typical for your world, but it's really how we started thinking about this. So a few years back, actually it's quite a few years back, when my wife was in the hospital for the last phase of her pregnancy, nurses or clinical assistants would come by every day, take vitals, among many other important tasks, and write them, and then they would write down the vitals on a piece of paper to document it into their systems at the nursing station later on. And I know all the CI folks out there, you guys are already thinking about there's all kinds of waste already with that kind of process. However, while she was doing that, she often also reminded my wife about a survey where my wife should rate her or him with a 10 out of a 10. Now, while the care was excellent and she never saw the nurses document or acting upon some of the feedback she would provide related to her experience. So while everyone of there was at that point focused on her outcomes, she never experienced an impact on the feedback of her experience. As a typical CX approach, just like Annette shared, a lot of organizations focus on satisfaction indicators like CSAT, NPS, and customer sentiment around these 3 E's Annette introduced, right? Ease, effort, and emotion, right? While customers experience the actual product or the actual care in this case. However, while they identify customer sentiment, CX teams often lack the ability to act upon the feedback and often focus on just reporting out this customer value, right? On the other hand, I was attending a lean conference some months ago, and while I was networking, I asked many of the CI practitioners attending the conference how they integrate voice of the customer into their improvement efforts, how they use voice of the customer to funnel their improvement efforts and prioritize their efforts, and how they know that their improvements would add value to the customers experiencing their products or services. The answers I got ranged from VOC being something like the customers are willing to pay for certain process steps without ever having spent time with their customers. Many were using quality or delivery data as a basis for improvement opportunities, while several said that they would be interviewing a few customers and using those insights to create their KNO or QFD models to identify improvement efforts. Most of the practitioners I spoke with really focused then on generating business value with their improvements. What we want to share with you today is a little bit of a three-step approach to bringing these functions closer together. First, as Annette described, using solicited and unsolicited customer signals and customer value to create cases for improvement. Second, the ability to prioritize these signals for action based on this business, based on actual business value. Right. Thirdly, really apply the CI framework to act upon the feedback rapidly, generating solutions and business impact based on what customers value. The critical element of this three-step approach is the one in the middle that prioritizes customer signals with the problem-solving action. To govern that process, we look at the business value on the one side and customer value on the other side as a Venn diagram, right? Just because our customers or your customers value certain things doesn't mean it's the right thing for your business to act upon. For example, customers often highlight price as a detractor, and if you reduce that price to, let's say, 0, I'm sure customers will love it. Your NPS is going to go through the roof, but I doubt you will have long-term success as a business, right? On the other side, you work hard to improve the delivery speed and really drive out variation in your manufacturing processes and decide for that additional feature and capability to add some fees to your customers. While that drives business value, it might also drive customers away. The governance to align customer value and business value in the center of the Venn diagram is critical for creating real impact with improvements or investments. Right? I want to talk to you, and I want to walk you through quickly an example where a nursing unit turned solicited and unsolicited patient feedback into a daily experience improvement and drove business value. As many of you know, healthcare organizations have standardized surveys for overall care experiences and outcomes, which used to come in the mail after a visit. Additionally, many organizations now have started to purposefully learn from their patients while they're going through the actual care process. This shift is subtle but profound because these organizations are moving from measuring satisfaction after the fact to identify friction and turning that into action in real time. Patients are continuously telling the healthcare teams where care is difficult, confusing, delayed, or stressful, and the impact of that is seen in operational data. Imagine a 32-bed medical surgical unit we used to work with. Like many nursing leaders, the manager receives HCAHPS scores, patient complaints, service recovery reports, call light data, readmission statistics, staffing metrics, safety events, and so on every day. The problem in this particular unit and for this manager was that everything for her arrived separately. By the time she was able to understand trends and see trends in her monthly reports, all those patients who gave feedback already had gone home. right? The team was looking in the rearview mirror, and improvements were slow to change the overall performance of the unit. We worked with the team and altered their existing daily huddle slightly to create what we call the 15-minute patient signal huddle, right? Instead of reviewing only operational and outcome metrics, the team included every morning patient signals, solicited ones like HCAPS comments, discharge surveys, follow-up calls, family feedback forms, and unsolicited signals like bedside rounding responses, nursing interactions, caregiver observations, escalations, transport delays, room changes. Every interaction became a potential learning opportunity for the unit. Through this, they identified many friction themes in the process. One of those friction areas for patients was around imaging and testing, really highlighting that nobody tells me as a patient when my tests are happening. Patients also shared the anxiety of waiting for imaging and the frustration about the delays, which, while interestingly, on the other side, no formal survey had highlighted this as an issue, right? Operational signals, however, showed that several of the functions supporting imaging, like transport or the imaging organization itself, had operational challenges throughout the day. So what the team did was they added this friction area to their daily huddle board to prioritize for action. They would ask in their huddle then which issues impacts most patients, which issue can we influence today. The problem statement for this particular imaging friction became something like patients are experiencing anxiety and dissatisfaction because diagnostic test timing and status are not consistently communicated. A frontline nurse then took ownership and started to lead an effort, right? Leadership, nursing leadership and leadership started to see a change from the traditional 60 to 90-day cycle of a patient survey coming in to consolidated report, to committee, to potential action being transformed into daily signals supported with some AI insights, daily huddles, KaiNexus entries into the dashboards, and local improvements within days. And a system where the most powerful patient feedback wasn't found in a survey score. It was found in thousands of moments where patients would tell or data would show what confused them, what worried them, what delayed them, and what made care harder than it needed to be. As this med unit combined some of these solicited feedbacks, unsolicited patient signals, used an AI insight generator, and their daily management huddle, they created a structured problem-solving approach using, in this case, KaiNexus. They created something much more valuable than just another voice of the customer program. They created a system where every patient interaction became an opportunity to improve care for the next patient.
So this is one example, right? And we're going to share another example, but this was one where customer signals revealed operational friction and then also helped prioritize the improvement work. But what does it really mean for you as CI leaders? What we see and have been seeing is that the organizations that make the most progress don't treat customer understanding and the understanding holistically of the experience, so in this case of the patient experience, as a separate activity, right? It's not separate. It's not add-on. It's built directly into the improvement system. And so this integration really is what's key. So notice that none of these actions required a major transformation effort, right? The huddle was already there. Signals were already received. Many of those signals are already there. The repeat contacts, transfers, frontline observations, the complaint trends. But the opportunity is to start viewing those inputs into prioritization and improvement decisions. So imagine, what if every improvement portfolio included customer impact alongside operational impact? If that was just the norm. Or what if daily huddles always surfaced patient or customer friction alongside operational issues. And then the same at the end, at the wrap of project teams coming to a review pause. What if they routinely asked, not just did we improve the process, right? But also, did we improve the experience of the customers that this organization serves? That's where those customer signals become powerful, not because there's more data, right? It's not about more here, but because they help direct improvement energy toward the issues that matter most to customers, employees, and the business. So at the end, it's not about adding another program. It's about enriching the signals we use to prioritize improvement work. Let's look at one more example.
All right, back to me. Another example of, aligning customer signals with concerted improvements comes from a medtech organization we used to work with. For many years, customers were telling this company in surveys that one of their biggest dissatisfier was around the lack of transparency of the entire process, from when the customers would prescribe the product to the actual delivery of the product, right? To the making and delivery of the product. So end to end, because it made their patient scheduling operation very difficult, and it impacted their revenue when they would have patients scheduled, but the clinical product didn't arrive on time, right? Improvements for this customer feedback were often deprioritized, as no real business value was attached to the feedback. In parallel, however, the operations team, the manufacturing team, worked incredibly hard to reduce the variation of their end-to-end operational processes, and even enabled within that a express shipping option for customers, because more and more customers started calling the contact center to expedite their cases because there's so much variation and long lead time. Now, even though manufacturing reduced the lead time significantly for the customers, the call volume into the contact center was about 40%, asking, where's my product and can you expedite my process? And it kept steadily increasing, even with the operational improvements, right? After looking at behavioral customer data, really understanding why customers were calling and why they were expediting, even after the lead time improvements, understanding churn signals correlated with this uncertainty of the process of customers moving away from the medtech organization to their competitors because of that, and shifting our customer interviews from the doctors to their staff, who was responsible ultimately for the scheduling process. We were able to create a business case that demonstrated the business value to address this customer friction issue, right? We aligned then these efforts and built an end-to-end improvement map around visualization of their progress status in the platform using some predictive machine learning, similar to what you experience in a DoorDash or a pizza tracker app, right? We also did further improvements in operations, reducing the need for express shipping for expedited cases and products altogether, and reducing its higher cost. And then also enabling customers to interact with the process directly in the platform and requesting product expedites by themselves with a click of a button using a GenAI chatbot. All these improvements along the value stream reduce the overall call volume by over 30%. Some customers would still call in the beginning due to their habit of having had to call to expedite a case and only trusting the system once they had made their call. So we had to create some scripts for that. But we reduced the annual shipping cost by over $10 million and reduced the actual churn, customer churn, generating more than $20 million of annual recurring revenue. Once we understood the impact we could generate, connecting unsolicited customer signals and solicited feedback with operational data, our improvement teams started to work much, much closer together with the customer experience team to replicate this process across other long-standing customer friction areas. So as you think about your CI work and opportunities to advance your work with more customer signals, we would recommend, the following simple activities. You could start as early as tomorrow. Right? First, just reach out to your CX organization if you have one in your organization or your patient experience organization. Engage with them around customer signals and customer friction areas they have identified through their work in their reports and dashboards. Then take that back, audit your project inventory. See if you have opportunities to add friction elements to each of your projects, existing projects, or if you're even missing areas, missing opportunities for improvement, right? Build a process to add more signals to your improvements and use a tool, could be KaiNexus or any other tool, to function as a prioritization engine for your improvements, right? I think that's really, really critical because I think most we often assume that organizations know what action to take, but most organizations don't. They have decades of dashboards, surveys, alerts, and workflows, yet the same problems still exist. So as you build this bridge with KaiNexus as the prioritization engine, I think that will help to identify opportunities and add friction elements so you can drive the improvements. And just like in the example before, as you close out projects, figure out a way to understand whether your improvements had actually made a difference to your customers and added business value at the same time you had anticipated for it. So we have a couple of resources for you to look at. They're all going to be in the slides, just to read up more on this and get more inspired and excited about adding customer signals into your CI work. What we wanted to start having a conversation now is like, where are unsolicited customer signals hiding in your organization right now? Just as Annette was explaining before. So I think that is the moment where we would like to really open up for a good conversation. Over to you, Mark.
All right. Thank you, Volker and Annette. Let's leave this up on screen for a minute here, this prompt, if anybody wants to put into the chat and answer thoughts about this question. Unsolicited customer signals that are hiding. I think what you both shared is really powerful. The difference between solicited surveys or solicited input, the kind of the self-selecting nature of who responds to the invitation versus things that are more directly observable. That's really interesting to me as a lean practitioner. And then maybe we'll leave the chat still open, so I think everyone's had a chance to absorb that prompt. I'll go through a few announcements. We'll open things up for Q&A and maybe read and discuss some of the things people are putting in the chat. There's a couple thoughts here already. Okay, next slide, please. Just a few announcements. Our next webinar is going to be presented on July 22nd, 1:00 Eastern, our usual time. Jeff Roussel from KaiNexus, he is our Chief Revenue Officer. He's been at KaiNexus for, I think 12 years. He has talked with hundreds and hundreds of leaders and organizations about CI programs, and he's kind of distilling his different observations and recommendations on this theme. The webinar is going to be titled, Why Great CI Programs Don't Get Funded and What to Do About It. There's the most important part. So we invite you to register for that. You'll receive an email if you've attended this webinar. If you're watching this on YouTube or listening to the podcast, you can sign up to get notified of future webinars at kainexus.com/webinars. And then there are well over 100 recorded webinars from the past decade. if you click on the big button that says Webinars on Demand Library. We also invite you to check out the KaiNexus YouTube channel. Next, please. Want to let you know about other free resources that we offer. One is our blog. We have new content on there every week about continuous improvement and navigating everything that we're all working on. You can find that at blog.kainexus.com. You can also sign up if you'd like to be notified about new blog posts via email. So again, check that out, please, blog.kainexus.com. And then next is our podcast. There's our friend, our semi-official mascot, Ophi, on the podcast logo. The KaiNexus Continuous Improvement Podcast will have the audio of today's session, a lot of other things that we put in the podcast feed, discussions between myself and our CEO co-founder, Greg Jacobson, other readings of blog posts and things that you can listen to. So please check us out, subscribe wherever you find podcasts. And then next, please. Final thing, speaking of surveys, speaking of voice of the customer, I put a comment in the chat. I mean, there's so many surveys. We get surveyed about everything. We do, invite you, please do give feedback. We do read all of the feedback. The feedback does matter. It doesn't go into a black hole. We don't do it because you're supposed to ask for feedback. Your feedback about today's session, your thoughts and ideas about future webinars really do guide our direction. So please do take a couple of minutes. That should pop up when you go to exit the webinar. With that, okay, we're going to leave this up on screen, and we've got a couple comments. I think answers to your prompt about those customer signals. I'm going to read them, and Annette and Volker, you can comment as you like. So Karen, who looks like works in healthcare, listed comments to staff, care techs, food delivery, housekeeping, nurses, things that are not captured otherwise.
I think that theme of frontline being such a bearer of essential customer signals is really key, and that's coming through here, right? That's across industries that we're seeing that frontline often senses and hears those friction points way before anybody sees any survey. But there's not often a good channel for frontline to actually provide those signals, right? Now, I remember we worked with organizations where you start a project with CI, CX, and you share that eventually with the sales org, and they say, well, finally, somebody's doing something about this. We've been hearing this for years and years, right? And then you're wondering, what is that channel? Because that also has an impact on the employee experience. Imagine feeling like you know the answer. You know where that friction point is. You hear it from the customers day in, day out. So yeah, I fully agree. Across industry, frontline customer signals are key.
Yeah, just to tapping one more thought into this, and especially in healthcare, right? I think it's in my opinion, is a very unique environment because you have your customers around you all day, right? So, and you interact with the customers, so you get real feedback all the time, and oftentimes this frontline team gets the impact, I think, or gets the insights, enabling them to document this easily, and then moving that feedback into a prioritization engine. I think that's really, really critical. So that not only the employee sees that, hey, I collected something and somebody is actually doing something about this. I think it drives a lot of engagement. And even if nothing comes out of it, but then if there's a feedback loop saying, hey, it's a good insight, but we have 35 other projects we're writing, we have prioritized before that, but we have captured it. I think that's critical. And I think I talked just briefly about AI in healthcare. That's a very challenging thing, but as interactions can get documented in a way, I think there's an opportunity to become much more natural in documenting these interactions and these themes, and then mining these themes for potential improvements.
Yeah, I'm reminded of a situation as being the family member of somebody receiving healthcare. And, you talk about the need to have some feedback loop and channel. and there's the insights that the frontline staff hear, and what I saw was the frontline staff being impacted in a very negative way. Was me making a comment about trying to go pick up a prescription at a hospital's outpatient pharmacy. And there was a disconnect between the posted hours online and if you called, what the voice thing said about the hours. And I took a chance and went at like 8:05 a.m., hoping that they really opened at 8 and not at the later time. And sure enough, they were open at 8. And I said, I think in the friendliest of ways to the pharmacist or pharmacist tech that was helping me, about this disconnect and it's confusing. And then the poor guy, the sigh and he wasn't rolling his eyes at me. I felt bad at that moment bringing it up because sure enough, then he said, what? I've been mentioning this for a long time. They won't fix it. And, that's sad to hear when, that lack of feedback loop is not only frustrating the customer or the patient, or it frustrates those frontline staff, right? Tell us more about your experiences around that. How do we not wear down the frontline staff by having these problems get constantly repeated?
Yeah, I think a lot of that, has to do with, making those insights visible and making this friction visible, which exists out there. And then, having a way to identify improvement opportunities against that. So if there is friction where there's no improvement against it, then that's an opportunity for us to really look and see, how would we, and then there's two options. We either accept it with some rationale or we do something about it. And I think that's really, really critical because that visibility then leads down to, as I described before, the ability and the trust in your frontline employees to say, hey, I brought something up and somebody took care of it. Or I brought something up and it's somewhere in schedule. And it's not something which will be done in 4 or 5 years from now, but it's something which will be addressed at some point shortly, hopefully as well.
So there's another comment. I think this is an answer to your prompt about customer signals. Sean wrote, number of touch points get actions completed, orders placed, returns or exchanges facilitated. So I don't know if that's in a retail or e-commerce kind of setting.
Probably.
Thoughts about like looking at touch points of, the customer saying, well, it was effective, but it wasn't as easy as it could have been. It sounds like it's in that category.
I think that's really crucial looking at the number of touch points because I remember an example where it was about closing a ticket, dashboard was green, everything was fantastic, but what was actually happening is that there was a transfer to another team happening, and every time the ticket got transferred, it got closed. So the first call resolution looked fantastic, bright, shining green on the dashboard, but really it took several touch points for the customer to get their action completed, right? So that was found out because they did exactly that. They looked at how many efforts did it take for this on an individual customer basis to get from this request to have it fully resolved. And that also pointed out an issue with the KPI management.
Yeah. Similar to that, the example I shared before in terms of touch points, right? So customers would look into that MedTech's platform every day to see, hey, is there a change? Do I have finally a delivery link attached to my order so I can follow the order as it's been shipped? So they would do this every day. And then, so there's a lot of touch points. And then they would pick up the phone, try to call, right? And, there's a lot of interaction that way. And it's really a lot of effort on the customers to find out when their product would be shipped to them, where all of the effort, the improvement effort was on reducing that effort and making it really easy for those customers to see and then to take action regarding their scheduling, regarding their clinic runs. And I think, having that visibility and removing the manual work out of their environment through, in this case, that visualization and the ability to interfere with the process in a simple one-touch way was really powerful. And I think that to me is like, we talked about the 3 E's, right? So it's effort, ease, and emotion. When we spoke with our customers after implementing, right, and really getting additional feedback on the tools itself, the one thing which really stuck with me is like, customers would say, it's now so easy for us. We're so excited to interact with the platform, and that we never had heard before. And so I think these 3 E's, they really work in tandem together. So as you look into removing touch points, exploring touch points, understanding your customer and what takes effort for them is really, really critical.
We have a comment from Shannon who wrote, when I was in medical imaging, I would visit patients waiting while the imagers were reviewing cases with the radiologist. I would pop in and ask about their visit, what's gone well, what could be better. It was one of my favorite activities because it's also the place to capture positive feedback as well, to share with other departments. And yeah, I've blogged about this before, about like getting all the surveys, and not once do I remember an office manager or somebody asking me like, what went well, what could have gone better. Like we do this after meetings at work all the time, the plus delta. And you have the actual voice of the customer, you have the customer right in front of you. In a lot of industries, that's not true. So I think it's great to hear that Shannon did that. I would hope others do. I see you both nodding, you probably agree, but anything to add about, the impact or, do's or don'ts about capturing live face-to-face feedback?
I think what really stands out to me here is not forgetting that positive side, right? I've heard many times that customer experience teams, departments become the naggers, the bearer of bad news, right? This is wrong. And I can see how this could potentially happen to a CI team as well, right? Like, this is not good enough. This needs to be improved. And so making sure that it's balanced to get champions has to be part of the design, to also capture positive feedback from similar signals oftentimes is really crucial to change the culture, right? To change that, to get that motivation going of, wow, this really resonated with the patient. We should do more of that. For any employee, if you have somebody that says, well, thank you for actually helping me with this, you want to do more, right? So that motivation is really crucial.
It's a question from Mark. Any suggestions for how to capture these signals from teams and call centers or service desks or similar IT technology operations easily, in all caps? Because many frontline ticket workers are already overwhelmed filling in the tickets.
Yeah, I love that easy then, Volker. You really don't want to ask frontline employees to become data entry clerks, right? That's really nobody wants that. So I think the first step is starting with the signals that already exist in the work. So look at those repeat contacts, the escalations, the transfers, the reopened tickets, and the recurring keywords in those descriptions. So there's all signals that are already there. And I think they can give you a lot of information. And then the second one to me is capturing signals shouldn't be an add-on. And I know this is an ideal word and it's behavior change, right? But ideally, it's part of an existing routine, right? It's not creating a new one. So, for example, in that daily huddle, right, ask one of those questions, like, what issue did you hear repeatedly this week? And you don't need everybody to fill in every time, but if that becomes a habit, right, it shouldn't be an extra on. And then what Volker said, AI is our help here, right? Instead of asking the employee, categorize and summarize those issues, this is where speech analytics and AI can analyze those call transcripts, the ticket notes, the chat conversation, and comment to hear that that is something that keeps on coming up, right? The customer mentioned something, even sentiment analysis, right? These customers calling about this particular issue have more negative sentiment percentage than they usually have. So there's something going on there without anybody having to fill in more data, right? It's not about more data. It's about using the technology we have and the data and the signals we have already.
Another question, this is a question I was thinking about during the session. Thoughts about, we talk about voice of the customer, and sometimes one customer is one customer. Like, how do you help navigate conflicting customer feedback, or trying to figure out when the voice of one customer is that representative of enough other customers, if not all customers?
Yeah. So maybe I get a first stab, and Annette, you can add to that. But oftentimes in the med device, med tech environment, you have key opinion leaders, right? That might be your biggest customers, your customers who do the work well, most experienced with the product, or whatnot. So, and they oftentimes dictate what you want to improve in the product on per se, right? So to counter that and say, hey, what's the broad audience saying? Is it the same? Is it different? Why is it the same? I think this is where we start utilizing our critical thinking and really looking at, is this a one-off? Is this noise? It might not be, because it's a big key opinion leader, but how do you deal with that? How do you interact with that when the data might say something totally different? So you might have different strategies to deal with it. I don't have a real prescriptive answer for that, but it's, if you get feedback, you have to do something with it, right? Because otherwise, feedback is a gift, right? So positive or negative. So if you don't do something about it, you basically tell this customer, however important or whatever his opinion or her perception is, that it doesn't matter. So you have to figure out a way to deal with it. Now, how the improvement work comes after is like, you really look at all the unsolicited signals and that will help you then to frame an improvement path. And it might be in line with what this customer is saying, or it might not be. And if it is not, you might want to close that loop with this customer and tell him or her, hey, we heard you, and this is what we're doing about it. It might not be what you expected, but we're doing something about it.
Yeah, maybe to add to that, I think this is one of my favorite moments when you get contradicting feedback, because this is like that puzzle that you have, something is going on here, right? I mean, that's just the starting point. It's like finding a really thick book and you read the first 5 pages and, you're like, wow, I still have so much more to go. So I love that moment. It means there's a story there. There's something to understand. And I remember one example where there was feedback from, it wasn't a huge amount of customers, but, solid enough, that said this one product it's really not working. It's frustrating. It's just not, it's terrible. Very, very negative critical feedback. And then I took this with the team to the product manager, and the product manager was like, no, this is completely wrong. Like, let me show you all the feedback I have. Everybody loves it. All the customers loves it. And so the product manager came and had absolutely contradicting feedback. And the short of the long story was, we were looking at different customer groups, and this product was designed for the experienced customers that Volker was referencing earlier, and they loved it, right? Like all those very highly experienced customers leaning in, right? Fantastic. But the bigger chunk of customers, the ones coming, in from university the last 5 to 10 years, they could not work with this. And for them and their staff, this was not a useful product. And so there was a big story underlying that contradicting feedback. So whenever you see that, if I were you, I'd get excited and just dig deeper.
Lean into it.
Yep.
There you go.
Well, we've got a couple thank yous for the ideas and suggestions. I think that is all we have in terms of questions and input from the audience. So I think that will bring us to a close. I want to certainly thank everybody for attending from around the world today. I want to thank our 2 presenters, Volker Probst and Annette Behrensmeyer. I think for some people, this is maybe a first introduction to the terminology and the approaches to CX. I think there's so much to think about in lean terms about observation and the expression about data versus facts. I think these customer signals and emotions or facts that are sometimes not always represented in data. So I want to thank you both. I want to encourage everyone, please join us for future webinars, including in July with Jeff Roussel. So thank you both. Have a great day.
And
thank you.